Just about 5 months ago, I came before this body. I issued a simple request to Republicans. I asked you to show me your plan to repeal and replace the Affordable Care Act, Mr. President. I asked you to show me the plan that was going to be, quote, terrific, end quote. The bill that President Trump promised during his campaign, the one Republicans had 7 years to come up with. I asked you to explain how you would meet the standard set by one of President Trump's top advisors, Kellyanne Conway, who said, quote, we don't want anyone who currently has insurance to have no insurance, to not have insurance, end quote. I asked you all to show me the plan that retains coverage for the nearly 20 million people who have gained it, continues to contain health care costs, and ensures that nobody gets denied or has to pay more because of their gender or because of pre-existing conditions. I never got that plan from you. Instead, what we received was the American Health Care Act, or the AHCA, a heartless, terrible bill that passed the House in early May, a bill that President Trump heralded in the Rose Garden after its passage as, quote, great, end quote. The AHCA is a far cry from what President Trump and his allies promised. If the AHCA becomes law, 23 million more people would be uninsured. The bill ends protections for people with pre-existing conditions and drives up health care costs dramatically for older, sicker folks. Worse still, the AHCA would end the Medicaid expansion and slash Medicaid by $834 billion over 10 years. And for what? To offer massive tax breaks to the wealthy Americans, to the wealthiest Georgians in the presiding officer's state. The average tax savings for the 400 richest families under this plan, $7 million apiece each year. $7 million each for every year. You know, because they need it. No wonder people are outraged. Just 8% of Americans think the Senate should pass this bill into law unchanged. 8%. That has to be a new low. Americans do not want Trumpcare. 3 in 4 Americans want President Trump and his administration to do what he can to make the ACA work rather than undermining it. Even President Trump reportedly now considers the House bill, quote, mean. Went from great to mean. In the Rose Garden, it was great. Now, just a few weeks later, that same great bill is mean. Instead of listening to the American people, Republicans are pursuing a strategy that former acting administrator of CMS, Andy Slavitt, has described as sabotage, secrecy, and speed. Up first, sabotage. A few years, Republicans choked off the Risk Corridor program, which was designed to help stabilize premiums in the first years of the new exchanges. The Trump administration has gone even further. It has stopped enforcing the individual mandate, undermined outreach efforts to help people sign up for health insurance, and cut the amount of time people have to sign up for health insurance coverage in half. But perhaps most troubling of all, Republicans have refused to commit to funding cost-sharing reduction payments. These payments help low-income families cover their out-of-pocket costs. Since insurers aren't sure if they can count on the administration to continue to provide these payments, some are pulling out of the individual market or are dramatically increasing their premiums to account for this instability, this uncertainty. There is much more that we can do to shore up the individual market. But my colleague, Senator Stabenow, had it right when she said to Secretary Price of the presiding officer's state regarding the administration's sabotage efforts that, quote, "It's like pulling the rug from under somebody and going, oh my gosh, they fell down," end quote. From Debbie Stabenow of Michigan. The next tenet of the Republican approach is secrecy. A group of 13 men have been meeting in secret to draft the Senate version of the AHCA. What little we do know is that Senator Cornyn estimates that there will be about 80% overlap between the Senate and House bills. Prior to now, our understanding was that the Senate Republicans, that you would completely rewrite the bill, with Senator Burr even saying that the House bill was, quote, dead on arrival, end quote. It sounds like that plan has been jettisoned. But we can't be sure because the Senate has had precisely 0 hearings, 0 days of public floor debate. And we have yet to see or hear about the revised draft of the AHCA despite the forthcoming vote. I urge my Republican colleagues to recall that during the long debate over the Affordable Care Act, the Senate held nearly 100 bipartisan hearings, roundtables, and walkthroughs, and had 25 consecutive days of public floor debate. Let me repeat that, Mr. President. Nearly 100 bipartisan hearings, roundtables, and walkthroughs. In the Senate alone, 25 consecutive days of public floor debate on a bill that affects 1/6 of our economy. In the Senate Health Committee, Democrats considered nearly 300 amendments during a 13-day markup, one of the longest in congressional history, and ultimately accepted more than 160 Republican amendments in the process. In 2009, then House Budget Committee ranking member Paul Ryan argued that, quote, before Congress changes health care as the American people know it, we must know the likely consequences of the House Democratic legislation, including the number of people who would lose access to their current insurance, end quote. The irony is palpable. Feel the palpable irony. You feel it, Mr. President? Does everybody feel it? That brings me to the final component of the Republican approach, and that is speed. Leader McConnell would prefer to have a vote on the Senate plan before the July 4th recess or shortly thereafter. That timing only leaves us a few days to go. There just won't be enough time to truly understand how this bill would affect the health care system, which again is 1/6 of our economy, Mr. President, and affects all the millions of Americans who rely on it. Republicans plan to schedule the vote in such a way as to keep the American people in the dark about this bill as long as possible. The American people deserve a chance to weigh in on a bill that would affect their lives and those of their friends and families in my state of Minnesota, in the presiding officer's state of Georgia. My office has received over 15,000 letters from very worried Minnesotans these past few months, and I've gone to visit rural health care facilities that would be among the hardest hit by the AHCA. My constituents, the people of Minnesota, are frankly scared about what will happen to them or their families if they lose their health insurance. And I am too. As I did in January, I would like to encourage my Republican colleagues to join me on a trip to Minnesota to meet Leanna. Leanna's 3-year-old son, Henry, has been diagnosed with acute lymphoblastic leukemia. His treatment, Mr. President, will last until at least April of 2018. Mr. President, he needs around-the-clock care to manage his nausea, vomiting, pain, and sleepless nights. Henry's immune system is so compromised that he's not supposed to go to daycare. So Leanna left her job to care for Henry. Henry and Leanna are supported by Leanna's spouse, but they can't pay for his treatment on one salary. Leanna says, and I quote, "It is because of the ACA that Henry gets proper health care. Henry can get therapy and the things he needs to maintain his health and work towards beating cancer. Henry is still with us because of the ACA." End quote. He's 3. Let me say that again. Henry is still with us, Mr. President, because of the ACA. I will do everything I can to fight the Republican effort to repeal the Affordable Care Act, strip away consumer protections, and gut Medicaid. To all of my constituents who care about this, I need you to keep fighting. Now is the time to make your voices heard. Thank you, Mr. President, for your attention, and I yield the floor.